Welcome to ADHD Wise podcast. I'm Jannine Perryman, and this is a space for open conversations about ADHD and neurodiversity, bringing together lived experience, professional insights, and the questions that help us move forward. Wherever you are in your journey, you are welcome here. Hello and welcome to ADHD Wise podcast. My name's Jannine Perryman. Today I'm joined by the amazing Sharon Marshall, who is one of my team, one of my friends, one of my coaches, my technical author, and someone I go to for quite a lot of things. Hello Sharon, it's lovely to have you.
Lovely to be here. Lovely intro.
Yeah, well, no, you're amazing, and I would be lost without you. So I'm very glad that you're here. We wanted to talk about neurodiversity and ADHD in particular, and being older and female. So sort of like menopause, perimenopause, life attitudes, being of a certain age where actually I think my priorities have changed. Have your priorities changed as you got older?
I think I remember less about what priorities are supposed to be. So it just comes in waves after a while.
Fair enough. Okay, so where shall we start? Sharon's 60 and I'm 52. And I think that, well, I mean, I think you might feel slightly differently to me on this, Sharon, but I actually sort of think that by and large, I think we can now ask people how old they are in a way that we couldn't when they were young, when older generations were our age. It was like you never ask a lady her age, that sort of stuff. I'm actually really proud of my age.
I think I'm proud that I'm still here because not everyone is. And not all my joints are still here. I have 4 new ones, but they're all right. So I'm not completely here, but then people would have always said that about me. So
Okay, well, let's go with that, shall we? What would people have said about you when you were younger?
I'm not comfortable even trying to remember that, to be honest. Definitely weird, definitely intense, too much, all of those things.
Yeah.
But that they still say now.
If somebody said to you now that you're too much, what would you say to them now?
Well, I probably wouldn't say what I'm thinking, because I'm now thinking, well, that's because you're boring or you're too little. So, and maybe I always thought that. But yeah, if people think I'm too much, then I suppose I'm not their tribe.
I think that's fair, isn't it? I think that whenever I've also been told I'm too much throughout my life. And historically, I would have tried to shrink in that situations and be not quite so much. Whereas if it happened now, I would say, go find less. I would absolutely say go find less, and probably quite unapologetically so, depending on who they were, because, there's no point in being confrontational with people who are not part of your life, not part of your circle. But ultimately, if it's somebody who is in your circle and somebody you do have to contend with on an ongoing basis, there is a boundary setting and expectation setting. It's just like, no, I'm good, thanks. Because I think that my intentness, and I think your intentness too, is actually a real asset.
I think it can be, but what I've noticed is that if I hear, and this is like when I was employed, so I was around people who didn't necessarily know me. And if I heard somebody describe someone else as too much and I knew they had ADHD, I would immediately shut down and think, well, I better not show them who I am because I'm going to be too much. And I don't want that judgment. And so I did alter my behaviour and sometimes go and have a cry in the loo, it's that kind of thing. And so because there's yet another rejection of who I am. So is that
to sort of like keep yourself safe?
Yeah. Because that's when the mask goes on, and I think that happens a lot when you're working with people that you haven't chosen to work with.
That's the problem with being employed, isn't it? But
yes.
Being sort of self-employed and at least having some say in how you spend your time, which you don't when someone's paying you to be somewhere and do something and mix with certain people. Yeah. Well, I mean, I don't necessarily want to labour this particular point. We've both got workplace adversity, shall I call it? Or shall I go one step further and call it what?
Go trauma.
Okay, we'll go with trauma. We'll call it what it is. We both have workplace trauma. And it's one of the things that working together, it does come up in conversation, and sort of, on Monday this week, there was something, wasn't there, that we just ended up talking about. And it's just so great that we can. And I wish more people could actually talk about what happened to them and be like, that wasn't okay. Because I think a lot of things that happen in the workplace that are not okay.
They do, but I also feel that they're not necessarily the fault of individuals because people just don't know. So, and like when somebody says, oh, talks about someone being too much, they don't know what that really means and what they wouldn't choose to hurt.
Okay, so it might not be malicious, but it doesn't mean that it doesn't hurt and doesn't do harm.
That's right, yeah.
I agree. I completely agree with that.
But when it's not malicious, you kind of take it on yourself, don't you? Because you don't want to upset them, because you know they didn't mean any harm, or most of them don't mean any harm. But in taking it on yourself, you're not actually educating anyone at all, which is why we need to have these conversations.
It is why we need to have these conversations. So I'm glad that we have kind of like gone there, because we will not be the only ones. And actually, it's really common for neurodivergent people to have adversity in the workplace, to struggle to stay employed, to have experienced adversity for things that were beyond their control. That is really very, very, very common, right? And it's also really common that women in their 50s onwards, so women significantly into the perimenopause journey, leave or are removed from their place of work. I think it's fine if it's choice. I don't think it's fine if it happens to them.
Yeah, but then when you're in it, you don't necessarily, I mean, obviously having ADHD, there's RSD comes into it. So you think that they're trying to get rid of you even when they're not. So there's that you need to take into account. And a lot of people like myself didn't kind of realise they had ADHD until menopause.
Yeah.
By then you're kind of too old you feel like you're too old to be employed anyway, because people aren't so interested in women in their late 50s.
Too old to be, maybe too old. You're not too old to be employed, but you might feel like you're too old to be employed.
Yeah.
And also, you might also feel like you're too old to pursue an assessment.
Yeah, for me, I didn't really have the choice. It was like that, or just take me away and put me in a dark room. It happened very quickly. When menopause hit, my HRT had run out without me knowing. I was grieving at the time. My mum had a major stroke, and so I was dealing with a lot and didn't realise how ill I was underneath all of that, because you kind of put it down to what's going on around you. And then it became clear that every cell in my body felt like it was hurting. And I thought I was dying. I went through that. So what have I done? I've put on so much weight. I've obviously done something, and I won't be able to get over this. And so the menopause diagnosis and the ADHD diagnosis happened at the same time. I don't remember much about my diagnosis because I was still in the menopause thing. But I did find out about it very recently, because now I've come off of medication. I don't need to see my psychiatrist. So I asked for my report, which I don't know where that is. Why would I know that? And I found out that for inattentiveness, I scored 7 out of 9. Mm-hmm. But for hyperactivity, I got 4 marks. There is no one who could have scored higher than me for hyperactivity. I probably didn't need to even do the test. I could have just sat there for 5 minutes and she could have diagnosed me based on that, I think. Oh, yeah. So it wasn't a surprise that I had ADHD, but I think it's after diagnosis that all my strategies had fallen down. Yeah. Because until menopause, although it had been suggested to me, because child has ADHD and said, you better get yourself sorted out. And I said, well, no need, because I can manage this, that and the other. And I had all these strategies on my autistic traits, as we call them, my label boxes and my timers and all those things. But menopause happens and strategies fall down. It's amazing the way it literally just crumbles, actually. I felt like
I felt like I had lost everything. And for a little while, felt like I was going right back to the beginning. Like, it's not, in the end, you're not going back to the beginning, but with neural pruning, when that's all kind of like happening and your brain is rewiring itself to get rid of everything that it doesn't think you need, you're going to lose some stuff that you do need. And for me, I felt like I'd lost my mind. And I think a lot of people do feel like they lose their mind in this phase of life. And realizing where I was on the menopause journey was part of it, because I think I'd been in denial about it for a little while. And then I was like, oh, okay, this is what it is. And I did, because my mum died of ovarian cancer, I was quite resistant to HRT, because if you've had breast cancer in your family or ovarian cancer in your family, they'd ask you to be careful along those lines. I think actually the advice on that and guidance on that has changed. And anyway, on reflection, my mum was in her 70s when that happened. So actually, I probably need to worry less. But it got to the point where I didn't feel like I could function. I felt like I was such a scattered version of myself that at times I could pull together, which made me realize it was a largely hormonal thing. But I obviously had, well, we'll call it adversity going on in the background that related to my last marriage. Just the sort of like the clearing up of that. So like you, I put my struggles down to my life challenges. And then as those kind of like cleared up, because that's what happens, you know, problems that are situational do clear up. What I was left with was this confused state of still not being able to function. And it was yourself and Vicky, who works with us, who were like, please go and try HRT. So I tried HRT, and I have the Everall patches, and they're amazing.
I couldn't keep one on.
Oh, really? What do you use?
I've got the gel.
Okay. So the
Got to
gel
remember it, but
the patches are really weird, because it's like it's every 3.5 days you're supposed to change a patch, which for somebody
couldn't deal with that.
really, really challenging, because it's less like, well, if it's every 3 days or every 4 days, if it's the same time on those days, that's a lot easier. But every 3.5 days, that's virtually an impossible thing for me. So what I had to kind of do in my head in the end was, I was just like, right, okay, so I've got one set of patches that I'm changing on a weekly basis, another set of patches that I'm changing on a weekly basis, and I actually have to keep 2 patches on, because I can't. I mean, that's how I'm coping. But they do stay in place for me, and they don't irritate me until about day 5, and then they'll probably come off around day 5. But that's how I actually cope with it. It's like, because I cannot do 3.5 days once a week at the same time.
Yeah,
I can do.
Yeah, I struggle with that, to be honest.
Pardon?
I struggle with that. I can maybe do every day, but you know, I'm not saying that I remember it every day. But the progesterone coil is brilliant, because you don't have to remember it at all.
No.
And for me, that was the game changer anyway. So I do use the gel, but if I miss it, it doesn't really make a lot of difference.
Right. Okay. Well, for me, I think if I have forgotten, my rhythms have slipped, about 2 days later, I'm paying the price for that. And of course, by then it's too late, and it's going to take another day to kind of like get to like balance off again. So, you know, it's a real challenge. And the thing is, of course, that would be the case with any woman. But it isn't just about that. It is the exacerbation of the ADHD during that time, because estrogen supports dopamine, and therefore you're going to have a doubling down of the deficit. And I know that is medical language. We don't like deficit, but in this context, it's incredibly, that's what it is in this context. Because your ability to cope is not there. So you are deficit and you are disordered. In this context, I don't like to use that generally speaking, but in this context, I would say that is exactly how I felt. I felt deficit, I felt disordered, I felt broken.
Yeah. Everything did fall apart for me too. Within 3 weeks of me having the progesterone coil changed, which was overdue for change and I hadn't realised, I did feel a lot better physically. because my blood pressure went down to normal. I wasn't breathless anymore. And I was breathless just going to the loo, so all the time. That's why I really thought I'd damaged something. And so that was a real game changer. But I did have resistance from the GPs to get both of those things. They recommended that, I remember her saying to me, "Are you sure you want to be taking stimulants at your age?" And yeah. And I wasn't sure at the time. I didn't have the assessment because I thought I was going to have the medication. I waited a while before I did that. But I needed to know. It's the self-awareness was important to me. So I wanted to know what was going on, and then I could look at what to do about it. And even with the, it was quite a struggle to even get my referral. And I had private medical insurance through work, but even getting the referrals, I was met with resistance for the menopause thing as well, actually. And there were delays on that. But I was offered antidepressants, though.
Oh, well, of course, because antidepressants are the answer to all of women's health issues, right?
Yeah. And I wasn't going to be taking those.
No. No. I mean, I had a short spell on them, and I think that at my lowest point when my life exploded, I actually think the antidepressants part of what got me through that worst bit. But that what quickly happened within 5 months was that I was aware they were actually keeping me down. So they were kind of like stopping me from bottoming out, but actually they got to the point where they were preventing me from. Can you hear that noise?
Sounds like a bee. Have you got a bee?
No, the builder has decided that now is the time.
Oh, that's fine.
Standing. So I'm expecting him to get the hammer out next because, men. No, I'm not. It's not. It's, yeah. So that's going to be an interesting one. And sorry to my sound engineer who's going to be going about that. Anyway, where were we? That was a distraction.
I think we were on antidepressants and the pros and cons.
That I felt like because we do know that I think that's the case. What I think I've just explained there is probably quite a typical thing. But actually, treatment-resistant depression, they do now realise is probably undiagnosed and therefore unsupported neurodiversity of some kind, or it might be related to autism, might be related to ADHD, might be related to dyslexia, or any of the other conditions that are part of the neurodevelopmental and learning and cognition stuff. They now recognise that treatment-resistant depression is probably neurodivergence in undetected and unsupported neurodivergence. So it's in origin is probably what that is, and also that we're metabolizing serotonin reuptake inhibitors differently to the rest of the population.
Well, I didn't give it a go because I don't actually know anyone on them who is not depressed still. So I want evidence that these things work. And I do think I have heard of people using them, like you said, to get over the worst of it and then maybe come off of it. And I can see you're still really distracted there, Jannine, by the noise.
And we could stop, but on the other hand,
but this is life. This is
life, and actually, we don't need things to be perfect. And if we're always aiming for perfect, that means we have to have expensive podcasting studios rather than
we don't do that.
Operating from home, which I absolutely could not afford a professional podcasting studio. So do you know what? Sometimes there's going to be a bit of background noise, and I think that's probably okay. I'm sure.
Expecting you to be attacked by a giant bumblebee, to be honest. That's what it sounds like to me.
It's just ironic, isn't it? Of the one day that I sit down to record something where it really, really matters.
Shit happens to me.
With a sand. When he said he was going to do some sanding, I thought he meant hand sanding, and I thought that's fine. No, he actually meant palm sanding. So. The tangent. I'm trying not to be distracted by that thing. Anyway, going back to things. So, can we talk about meds a second? Just because we've been talking about antidepressants and that they are a serotonin reuptake inhibitor. I find it really interesting and but not uncommon that you struggled to be taken seriously for assessment, but also for med. And yes, of course, we do recognise that any stimulant-based medication is going to potentially increase your heart rate. Therefore, there are reasons that those are the reasons that that they will test for those sorts of things, and those are some of the risk factors associated with it. But was that an issue for you? Did you have an issue with your heart rate?
I did until I got the coil change, because I didn't know if I did, but my blood pressure had gone up.
Now that's so interesting, isn't it? So for both of us, our blood pressure went down HRT, which would have made it possible for us to have the ADHD medication, but might have been an alarm bell. Another thing that's really, really interesting is that there are some blood pressure medications that are also good for ADHD, such as guanfacine. Try getting that from the NHS.
All right,
Interesting. Both ADHD and high blood pressure, but try getting it.
Yeah. Well, I ended up, I wasn't on medication for blood pressure at the time because it wasn't that high. It was just high for me. And, but it just happened to come down within weeks of me having that coil change. And maybe it was because my stress levels were different, because I had more of what I needed. But I was still pretty broken, to be honest, and felt like I've been dragged through a hedge backwards, because it was such a traumatic experience, and then having to fight to get the help as well. Even when it was private, I still had to fight. And GPs who were trying to give me antidepressants. I'd never got depressed before in my life. I knew what depression felt like because I'd had severe premenstrual things, which I now know is related to ADHD, but I didn't when I was in my teens and early 20s. So I was on progesterone then as well. It was kind of a new thing. It's a bit experimental, but it seemed to take the edge off it for me at the time. So, yeah, and then I've lost my train of thought there. Where was I?
I don't know. Because there was noises coming from my side.
I'm supposed to be through this. I'm supposed to be well over the hill now. Yeah, so where was I? And we can cut this bit out, can't we?
No, we won't cut this bit out.
Probably not.
Because this is the real lived experience. This is what it's actually like. And one thing I really want this podcast to be is real. I don't want it to be staged and prim. I want it to be authentic. So you're going with it. It's all good because I have no idea where we were talking about. No, what were we talking about? We're talking about you having to fight. We're talking about the fight.
Fight for the medication, yeah.
Yeah.
And feeling pretty broken.
The assessment.
Yeah. And but I think there's a lot. Self-awareness is huge. So without the assessment, you don't know what you're dealing with. And when you go for the assessment, there's always that feeling, and I get this from clients who are going to be assessed as well. What if I haven't got it?
Yeah.
What does that mean if I haven't got it?
Yeah.
They normally have it.
Of course.
But and I don't think anybody who knew me would doubt that I had it. But there's that fear. If I haven't got it, am I really losing my mind?
Am I imposter?
Yeah, and dementia, early dementia, all of that goes through your mind, doesn't it? And knowing that some people do get diagnosed with that.
Well, dementia is actually higher prevalence for ADHD people than it is the rest of the population as well.
See, I'm not sure whether it's dementia because having seen what my dad went through, I think it can be diagnosed in that way. But is it just like if people came to see me, if I was 20 years older and they saw how disorganised I can be when things fall apart, they'd just take me to the care home.
Well, I think also
rather than give me the support I need.
So I rarely have a meltdown. Sometimes I'll have a bit more of a shutdown. I'm somebody who will kind of like under stress might sort of like shut down.
Yeah.
But occasionally I'll have a meltdown. And imagine doing that at our age. That would probably be read as dementia.
The older you get, the more you are at risk of the wrong diagnosis.
Yes, my Andy's mum's in hospital at the moment, and she had delirium from basically being sat with nothing, no stimulation. She can't see particularly well, but she can hear like everywhere, probably has kind of like sort of extra hearing. So she's hearing everything, but only kind of like sections of it because it's interplayed with beeps over here and whatever over there. And she made up this whole world in her head because she had no access to the television, no access to radio, very infrequent visitors. And so she developed delirium, and they were trying to say that it was dementia. And I was like, no, because when I've sat with her and I've said, oh, do you want me to tell you what I can see with my eyes? She says, yes, please. And I tell her what's going on. She's like, oh, my brain is making up all sorts of stories, isn't it? So we fought to get her home, because when she's back in her own home and she's got access to Emmerdale and, EastEnders and the news, and she follows the football and various other things, because she's an intelligent woman, she was absolutely fine. So I was absolutely right. It was not dementia. It was delirium brought on from being understimulated and basically sat there. She had a water infection, so the combination of things meant that kind of kicked in. But the problem with delirium is that the more often that happens, the more often it will happen. It's one of those things that like leads into that. So it was like, no, we have to get her home. So yeah, I agree. The older you are, the more you are at risk of being mislabeled as having dementia. And I think it's particularly if you're female.
Do you think so?
I think so. I think particularly for females, because of the hysterical woman type sort of stereotypes. I do think it sort of like happens more for women than it does for men. And dementia, Alzheimer's, etc. If I could have a magic wand and remove those, I absolutely would, because to be aware that you're losing your mind that way is not fair, is not kind. It's an incredibly cruel way, isn't it?
Yes, but I think what I saw with my dad was that people were telling him he was losing his mind, and actually there wasn't progression. It was all related to anxiety. So if he used to hold his breath rather than breathe, so if he breathed, he could be back to normal. And as far as I'm aware, that's not a cure for dementia. But it was that stark. It was so obvious that he was having like an internal panic attack. And I wanted him to get treatment for anxiety. I mean, I didn't know about neurodivergence at the time, but he obviously was. No, he was weirder than me. A lot weird. No, I mean, I'd say he definitely had ADHD symptoms, a lot, and maybe more inattentive, but a lot of anxiety, and he also he had a lot of autistic traits. And my mum covered for him for most of his life. Okay.
Well, I'm not going to share my parent experience here today, because if I do, then we'll definitely overshoot the target for this particular podcast. But I will say that I have a similar account to that in many, many respects. And I think recognizing our parents' neurodivergence is really quite helpful. And I don't necessarily know that it's always about diagnosis. I think sometimes it's about identification. Sometimes you need a diagnosis because you need to be sure. And sometimes it's okay to just explore it for yourself and to be able to say, no, I understand what the problem is. Because my belief is that you can't solve a problem unless you know what it is. You can't solve a menopause problem unless you know that's what it is. You can't solve an ADHD or for other neurodivergence condition until you know what it is. I know that when I was 41 and finally diagnosed ADHD, that it changed my life, because I understood the problem and I got real with myself in a way that I couldn't before, because I didn't know what was going on.
Well, I think it took a while to sink in what that actually had meant for my life, because I was, as I said, when I got the diagnosis, I was in the throes of the menopause thing and that hadn't been fixed. And I did some massive oversharing at work as well, which I don't think I ever recovered from. I think once you've said it, you can't take it back. And when you share dark thoughts, people get a bit worried around you, I think is the best way to describe that. I don't get worried when people share that with me, but then I've done some training on it. So maybe that's what it's about. I've done quite a bit of training on that kind of stuff. So but yeah, I think it was at the time when in work it was it's good to talk, it's good to talk, it's good to share. There was all that message going on. I wasn't thinking straight, and I'm
There's a price to sharing.
yeah,
And
huge
not
price.
everybody's a safe parent, a safe pair of hands.
Yeah.
Not everybody's a safe person to know what's going on with you. I make people earn the right to know me now.
I don't think anybody used it against me deliberately, but I was shut down.
Yeah.
I was told what I could and couldn't say because it upset people.
Yeah. Yeah.
And that kind of upset me.
Yeah.
But I understood. On the one hand, I understood, but I was out of control because I didn't have the control over myself.
And I think that's the thing, because I share quite a lot about my story, but I try to speak from the bruises and the scars, not from the open wounds. And I think when we are emotionally bleeding everywhere, that can be really, really problematic in the workplace and in life. And what I wish people had is a safe space to go and emotionally bleed, where it's a one-way lean and that it's sort of safe and it's contained and we looked after people. That would be what I want from my healthcare system in terms of is that people could genuinely be listened to and helped to process so that they can get to the point of scars and bruises. And then you can talk to other people from the place of your scars and bruises. Then you're not passing on the pain, you're passing on the wisdom, because we do a lot of passing on the wisdom, don't we?
Yeah.
Coaching is very much, holding space for other people, being that one-way lean for people. But there is wisdom that we people tap into, right?
I've just another experience occurred to me then. They had an employee assistance program. So I called them thinking, I'm going to get some help from someone who will listen. And they told me that I was too bad for them, basically, and I needed to get more professional help.
But did they help you to get there?
You're too nuts. They didn't arrange it. No, I had to do that myself.
Oh, see, I also have a problem with the self-referral sort of stuff. I've seen that go wrong too many times because people, when they're at their lowest, can't do self-referrals.
No.
And so...
Especially when the doctor won't do it. You have to argue.
We're sort of like sliding into other territories here, and we could end up making another like 72 billion podcasts based on that particular topic alone. But going back to this point, we know that a lot of ADHD symptoms are worse during this stage of life for women. And that's why a lot of women get diagnosed later in life. Because they have been overperforming in order to keep up. So if you have done extra hours, gone the extra mile, worked harder to keep up, and you hit the perimenopause, and you no longer can do that extra labor, those extra hours, your capacity to do it has just diminished. That's why a lot of women get diagnosed later in life.
Yeah, so it's not overdiagnosed. It was just undiagnosed for many years. And
underdiagnosed in women. And I do feel it's a real sort of like women's issue that we have such a problem with the fact there's been an increase in ADHD diagnoses. Because not taking anything away from men, because they absolutely deserve to be assessed. But so do we. So, if it doubled, I know it's more than doubled, but if it doubled, it would be about redressing about equal numbers of men and women getting assessed. But it more than doubled because there were so many women who hadn't been diagnosed or assessed, because diagnosis and assessment are not the same thing. It's a women's issue and a girl's issue that there are so many assessments taking place now, and they should carry on. And if they don't carry on, and when you look at the things they're trying to cut down on, whether they're trying to change the parameters, they're trying to reduce it so women can't be assessed. And we could definitely go off on one about that. I'm not going to, because we've got a podcast coming on with Becca, one of the other ones that we're recording this week, which is on gender differences and ADHD. So I'll back off from that particular train of thought, but just kind of like acknowledging that, that's a women's issue. And of course, we're today talking about perimenopause and menopause and the combination of ADHD and broader neurodivergence. Because if you were on the edge of coping and then you hit perimenopause, there you
Going back to what you were just saying about gender difference, I think there is a point needs to be made here that when women go through that, they might find a voice that they'd been in control of before. And if they were male, that outrage or whatever outspokenness is so frowned upon, if they were male, that might be acceptable. But because you're female, it's like you can't do that.
We we do have to also recognise men also have their own stereotypes. So you get the sort of like, midlife crisis when they go and get themselves a flasher car and everything else. Why should they be apologetic about why should we be embarrassing men for that sort of stuff? Absolutely, we shouldn't be doing that either. But, there are issues there as well. I wouldn't say I know so much about them because
we can't talk about those issues.
We can't talk about them. We have to recognise we'd only be amplifying something that isn't ours because we can only be allied to that situation because that's not our lived experience. Our lived experience is neurodivergent women of a certain age. On that note, I have a question for you. If you could go back and tell your 30-year-old self something, a bit of advice, what advice would you give your 30-year-old self?
Get diagnosed. I started my personal development journey around about then, so it's been going a long time. Yeah. If I'd had that knowledge then, that journey would have been so much quicker.
Okay, all right. So what about your 40-year-old self? What advice would you give your 40-year-old self?
If you haven't got diagnosed yet, get diagnosed.
Okay. And 50-year-old self, same.
Because without that, you're feeling around in the dark. You just don't know. And I need that certainty. And from what I understand, talking to other people, because we doubt ourselves so much, we need to be validated. And we doubt ourselves because of the messages that we've got.
Oh my gosh, yeah.
Yeah. So that validation is everything. It's a piece of paper that actually tells me I'm not imagining it. Fantastic. After all these years of being told I'm imagining it, I'm dramatic and
so much. All of that stuff.
Yeah.
I think that is a really, really good place to stop. And I just want to say thank you so much, Sharon, because I really enjoyed recording this with you. And I hope that people really enjoy listening to it. Sharon is an amazing coach, particularly interested in coaching people who are of a more mature age. So if you're listening to Sharon and you're thinking, I like her vibe, you will find her on our website, www.adhdwise.uk. She does have her own business as well. We will put the link to that in the chat too. But Sharon, thank you so much. And I hope that the listeners have enjoyed listening to this. Thanks very much.
Thank you.
Thank you for listening to ADHD Wise podcast. ADHD Wise exists to help bridge understanding and support for people exploring ADHD and broader neurodiversity. If you would like to know more about us and our services, please visit www.adhdwise.uk. Follow ADHD Wise UK on Facebook, Instagram, TikTok, and LinkedIn. Take care, and we'll see you next time.